Hello, everybody. Welcome to Webinar Wednesday. My name is Martin Lovers. I'm the Chief Trend Watcher of Supply Chain Media. We have a great topic, a very important topic. We're going to talk about the vaccination distribution or the supply chain issue of for COVID-19. And with me, I have three experts. You see me on the left, that's me. And next, Jan van Zo, Professor Operations and Logistics Management at Tilburg University and Eindhoven University of Technology. Jan, welcome.
Happy to be here, Martijn. Thanks for the invitation.
No problem, you're welcome. And next, Ara Gopal. He is Head of Industry and Partner Solutions of Anaplan. Ara, welcome.
Thank you, Martin. Thanks for having me on.
Hey, no problem. And last but not least, Murali Murugesan from Tata Consultancy Service. Welcome. Yeah, thanks. So welcome everybody to this interesting webinar, a great topic and about important topics. And it's about the vaccination supply chain, I would say, but you can also extend it to your own supply chain matters. We'll talk about that. So this webinar will be recorded. And there you have the ability to ask questions. On the right-hand side, you see the question mark, small, and then you can ask questions there. If the questions are in line of the conversations I'm having with one of these experts, I will ask them right away. We do have a Q&A at the end, but if you want to have this question asked right away, be happy to fill in this question and I'll pick it up. And this presentation will be recorded, and we have some slides, and this slide deck will be made available after this event. And next, after 5 o'clock CET, we have 30 minutes of an after talk, so you can sit down in the lounge and you can talk to one of these experts directly. So you can have your questions directly asked to them, and you can have a direct conversation. It looks like a Zoom meeting. It's in the same environment, so we have a lounge afterwards. All right, but now to the topic. So, vaccine distribution is a very important subject. In the Netherlands, we have 17 million experts about vaccination, or actually 17 million experts minus one. I don't consider myself an expert, but I have experts here, and they will talk about what the problem is. So if you look at how it's been presented, so a lot of logistic experts in the Netherlands thinks, okay, this is quite easy how to distribute vaccines, and they have this kind of slides. You have cooled or non-cooled, and you have different kind of supply chain, and that looks about it. And then all kind of advice will be given by these experts. But in reality, we see it's way more complex. So you see all kind of parties involved. So you see the manufacturing companies, you see all kind of legislation, the logistic companies. So there's a whole ecosystem around it, which makes it very, very complex. So it is a complex issue, and that's what we're gonna talk about. But first, I'm gonna ask Jan to introduce himself, but also give a better insight of the Dutch context of this whole challenge. So Jan, can you introduce yourself, who you are, and how you are involved in all this?
Yeah, thanks very much, Martijn. So I'm a professor of operations and logistics management. One of my areas of attention is supply chain planning, and actually no background at all in healthcare logistics. But late last year, I started to get a bit interested once I got a few questions from the media on what was supposed to happen. And as you may know, here in the Netherlands, we struggled quite a bit to get the vaccination process started. Since the end of January, actually, we are now currently involved with a number of people. I'll talk a bit more in a minute. But maybe a few words about the Dutch vaccination program. So the Netherlands is in a part of the European Union, and as part of that, the supplies of the vaccine are contracted by the European Commission. So in a sense, it's kind of an interesting setup, because all of the 27 countries in the European Union, they get more or less the same amount of supply of vaccine. And there are quite some differences. And I think part of these differences can be explained by the healthcare system. And in the Netherlands, there is a decentralized system, not partially geographically decentralized, but also decentralized in terms of responsibilities. And it's also mixed public-private. And this vaccination campaign, for instance, there's a National Center for Disease Control, the RIVM, which is part of the Ministry of Health, and they coordinate the campaign. And then in terms of actual execution in setting the vaccines, there are public health service, which in the Netherlands are regionally oriented and governed, and they are funded at municipal levels. There are 25 of these health services. So you mentioned the 17 million people. I'll divide them by 25 to get an idea of that execution. And they're all independent. And there essentially is no central authority over there. And then we have about 5,000 general practitioners. They are independent entrepreneurs. And again, also there is no coordination there. And then in addition, we have about 100 hospitals that are also independent actors. Now, under normal circumstances, non-pandemic, there is a market-based system where the government sort of funds non-insurable or difficult to insure costs. But under the pandemic, the funding, at least for the pandemic efforts, comes directly from the Ministry of Health. So it's a kind of an interesting situation that the Ministry of Health pays the check, but does not have any formal line of command towards any of these bodies here, with the exception of the Center for Disease Control. Now, if you could click through, Martijn, so this has led actually, forward, to a difficult start, as the Reuters here reported, because essentially we had a slow start. The campaign was prepared as if this was the annual flu campaign, which is actually a world-leading program, but which assumes that there is ample supply, that there is just one shipment going out to general practitioners, and there's one moment where all of the elderly and vulnerable people get vaccinated. And this is very different here. What I'm part of is a pro bono independent advisory team of supply chain academics and professionals. And we work with all of these independent partners and the ministry, basically providing them with advice at their request, but also with advice that they may have not requested. And our purpose essentially is to steepen the curve. And we call ourselves also the Operation Steepen the Curve, rather than the flatten the curve, because steepening the curve, this is the challenge in the vaccination program.
So, but how do you get this kind of role? Because a lot of people volunteer to advise.
Yes. So it's not so trivial, because actually, from what I understood, since all of this got out, the ministry got like 300 requests a day from anybody offering their services. So we also had quite some difficulty getting in. What we did in the middle of January as a group of professionals, in a sense, is we formulated an offer. So we said, this is what we could do. And we stressed there is that we are in pro bono and independent, and also that we have no interest in staying involved after this campaign is over, because none of us have any link to the healthcare industry at all. None of us are also consultants. So we stressed our lack of any interest. And then we essentially used our personal networks to get in and to get an opportunity to speak. And we, at some point, we managed to get through. They gave us half an hour to pitch. And after that, we were in, basically.
And what kind of people are involved and what kind of companies?
So in our team, so we have a core team. There are a couple of us academics, a couple of students, and then people from ASML and Heineken, two companies. And behind that, there is a team of probably about 30 people. And these are modelers. So that those are also people from various companies, students, academics. And we have a very large team of operational excellence lean experts, because if you look particularly at the mass vaccination sites, this is an issue of, this is just an assembly line, right, which just needs to be optimized. And these are people from probably 15, 20 Dutch companies that also volunteer their time.
Before we get into the kind of supply chain matters, I was wondering, I read earlier this week, somewhere on a Dutch website about logistics, that there was an advice to go into the neighborhood with buses to do the vaccination. So what is your response? Firstly, that has been published and advised, and secondly, is that a sound advice?
Well, I think in the end, to make this campaign work, you need both mass vaccination, just to get the sheer volume out, and also to be able to handle periods of very short supply. Because in periods of short supply, it's very difficult to spread this thinly, right? But in addition to that, you also need proximity, particularly to get willingness to vaccinate up, to get into the fine-grained system there. Whether you need buses to do that, I'm not so sure. I think we have general practitioners that are very well equipped for that. But I think if you look at that program, I think the idea to get in a certain phase of the campaign out into neighborhoods, in particularly neighborhoods where willingness to vaccinate may be a bit lower, this is very useful. But to get up to speed in the phase where we are now, this is where we need large mass vaccination sites.
Yeah.
And I think we need both. And it's not an and, an or, it's an and.
Okay. So now get into the supply chain complexity. Maybe you can explain how complex it is as a professor and observer.
Yes. So the way, sort of, I think what you see it was interesting in the two graphs you showed, Martijn, because this very much looks at this as a product supply chain. Mm-hmm. Right, and that product supply chain in itself is already quite complicated, because the manufacturing processes, these are all newly ramped up, which typically means that they are not very reliable, because in many cases these are new facilities, in some cases also new processes. So this causes disturbances. But also the products are sometimes difficult to handle because of the particular cold chain conditions and life cycles. And also the fact that even the cold chain conditions, they are developing as we get to know more about the vaccines. Right. So, for instance, if you look at Pfizer was originally set out to be stored at minus 80 Celsius. And then after getting at fridge temperature, it could be kept for 4 days. Mm-hmm. Now, Pfizer has an additional opportunity to store it at minus 25 for 2 weeks before you thaw it completely until +2, right? Now, this is a new development, and obviously this has a consequence for your supply chain. So I think the fact that also the characteristics are changing over time also adds to the complexity. Second, there's also uncertainty in product characteristics, in regulatory restrictions. They are also changing over time as we get to know more about the vaccine. And the regulatory restrictions are also different in different areas. So between the UK, the US, and Europe, they are different. But even between different countries in Europe, there are different interpretations of both the EMA restrictions, European Medical Authority, and the restrictions that the manufacturers give. And then there is uncertainty about the production capabilities that are already mentioned. And finally,
Yeah?
sorry, you have a question, Martijn?
Yeah, about the scarcity and supply.
Yes.
I read this morning that the EU countries, they have outsourced the procurement of vaccines to Brussels, but there is such a high scarcity in supply that they are now considering to do it on their own, each country.
Some countries are, right? So I think this is where a bit of the debate is. So you see, for instance, Hungary, Slovakia, they have bought now the Sputnik vaccine to try and address the scarcity issue and also the regulations of in approval, which are different. I still think for the far majority, I think the countries are following the EU and the EU procurement policy. I think at this stage, we're also a bit at the turning point because this month already in the supply schedules, the deliveries are going to increase substantially. And from April on, even more. And we will move gradually into a situation in which the supply of vaccine will still be scarce in the sense that we cannot have everybody vaccinated within a few weeks, but the scarcity will be complemented by scarcity of capacity. And this brings me to my next point on this slide, because if you look at the supply chain, this is not just a product supply chain, but this is also a service supply chain, because the only way in which to get a vaccination successful, an inoculation successful, is not just to have the vaccine, but also you need a vaccinator and you need an upper arm. And this makes it also a service supply chain. So the capacity planning of the vaccinators is really critical. And here in the Netherlands, the Dutch government announced last week is that they are going to create a surplus of capacity there, so that if the supply of vaccines is increasing, there will not be a situation, or there should not be a situation, in which there's a shortage of vaccinators. And thirdly, we also need to make sure that at some point there is not a shortage of upper arms. This is what you see now happening, for instance, in Germany, where there is, with one of the vaccines, the AstraZeneca vaccine, a very low willingness to be vaccinated. This essentially, there are vaccinators, there is vaccine, but there's no upper arm.
Yeah.
So all three are a requirement to make this process work out and to ensure that within Europe, it's fully possible to have everybody that's willing to be vaccinated actually vaccinated before the 1st of July.
Yeah.
But then you need to act on all three sides. And this is what also adds to the complexity of running this, and which ensures that this is not just the product supply chain or product logistics. It's also about vaccinator resources, about smart appointment scheduling.
Yeah, and there's a question here. With AstraZeneca and also Sinopharm, it's easier to use this vaccination because you only have to use it once. That's also one small factor. But is it a major factor?
Well, as far as I know, both Sinopharm and AstraZeneca need to be done twice, but the interval is larger. But Johnson & Johnson, which we call Janssen in the Netherlands, because actually the active ingredient was developed here, right?
Yeah.
But Johnson & Johnson has been approved for only one shot.
Yeah.
And of course, this makes it easier. It makes the deployment easier. What also makes it easier with AstraZeneca and Sinopharm is that the shelf life is much longer once it is at fridge temperature, right? So Pfizer, once it's at fridge temperature, you need to use it within 4 days. Moderna, I think it's a few days more, but also there are many restrictions there. So these mRNA vaccines, they are not so stable once they are at fridge temperature. But AstraZeneca can be kept for, I think, up to a month or so. But in any case, a much longer period, which makes it also easier to handle, for instance, in a general practitioner's practice, right? A family doctor.
But in the end, it's a different kind of supply chain. Well, in a CPG environment, you have a product and you have to supply it. But now you have different kind of suppliers that could supply this vaccine to the end destination.
Yeah, although what the suppliers do is they typically supply to a national or state distribution facility. And then, as far as I know, in most countries, the 3, 4, 5, maybe 6 vaccines that we will have in April, they will be distributed using a more or less centralized type of control. Because in a sense, these vaccines are partially interchangeable also.
Yeah. And to add to the complexity, I would say, it's also contract manufacturing. So Sanofi will produce from others, and
so on the supply side, the co-manufacturing, as they call it politely, but in fact it's contract manufacturing as you describe it, Martijn. This is very critical to get the capacity growing. And now that Sanofi and Merck in particular, they sort of missed the race, their own vaccines will come too late. So Merck has already formally stopped the process. And in the US, under the Defense Production Act, they have a marriage of understanding, which has been arranged by the US government with Johnson & Johnson for production. And it would be good if these type of arrangements would also develop a bit faster here in Europe, right? So Sanofi, I think, is close to announcing an agreement with Pfizer.
Yeah.
I don't know what the pace is, right? So the thing is, we need capacity over the next 3 months.
Yeah.
The later capacity is also important, but not for the current campaign.
Okay. All right. What we have seen in the Netherlands and also elsewhere, it's also an administrative challenge and an IT challenge. So I would like to go over to Ara from Anaplan, because they have developed a module or an environment for this kind of purposes. So Ara, could you first explain how complex is it in your opinion?
Yeah, I think the discussion we just had touched on a lot of these complexities, right? The one aspect I want to add to that is if you think about an ecosystem like the one we just talked about, right? From a decision maker standpoint, from the standpoint of these various stakeholders that are part of these ecosystems, how do you really orchestrate this thing, right? It's a complex dance, right? You have so many different partners, so many different data flows, so many different things that need to be coordinated. Now, if you think about this, if you're trying to model it, right, your audience, I think as supply chain practitioners, we all look to see how do we model the system, right? And what are the fundamentals of modeling any system? We need to understand the constraints, the variables, right, the rules and the assumptions. Now, with this thing, what we have is a constantly evolving system, right? How do you quickly model something where the constraints are changing? Jan just talked about, new vaccine types with different cold chain requirements, right? 1-shot versus 2-shot. Governments opening up new channels of distribution, right? If you're a private enterprise, that's a huge deal, right? Opening up a new channel of distribution is a very, very complex undertaking. But that's what's going on now, right? Instead of, at least in the US, right, the federal government allocating capacity to the states, now they're also allocating a small portion of the capacity directly to large pharmacy chains. They want to start allocating more directly to urgent care clinics. So not only is the number of vaccines changing, the requirements and the complexities of each vaccine is different, but we're also trying to open up as many avenues, as many channels of distribution as possible. So if you're somebody that's part of this ecosystem, right, you could be a hospital network, you could be a vaccine manufacturer, you could be a provider of consumables, right, PPE equipment, swabs, whatever that's needed at the site. Or you're somebody that's trying to deal with some of the capacity issues that Jan was just touching on, right? this is as much of a workforce and human resource problem as it is a supply chain problem, right? It is equal parts a financial problem. So if you are a private enterprise, you're trying to be part of this ecosystem. How do you plan for this, right? All of this is going to need investment. And if you're a public company, you still have accountability to your shareholders. How do you plan for this? How do you allocate capital for this? So what we're seeing is this complexity. It was complex to begin with. It continues to evolve, which adds to the challenge. And then on top of that, it's not just a question of how fast can we move the actual supply around. There's all this other stuff around, how do we avoid negative headlines? How do we ensure equitable distribution of vaccines to different population groups? There's so many different factors that are coming together. And if you go one more slide, Martijn, what we're seeing and hearing in the conversations we're having, right? And we have the opportunity, maybe I should take a step back here for your listeners that may not be familiar with Anaplan. We are a cloud-based enterprise planning platform, right? We work with some of the largest companies in the world. We have more than 1,500 customers. What we do is really be that enterprise-wide planning and decision-making layer, right? We do a lot of that in the supply chain context, and we also do that in areas outside of supply chain, right? So that gives us the perspective. We've been able to have a lot of these conversations with decision makers. Actually, Martijn, if you don't mind going one back, I just want to touch on a couple of things there on the previous slide. Yeah, so what we are hearing from these decision makers, we are approaching this from how do we better serve the decision maker and the planner, right? That's trying to orchestrate all of these things. So the questions that are coming up is, yes, we need to deal with all of the issues that Jan was just talking through, but at an operation level, these are the things that people are struggling with, right? Hey, how many nurses will I need next week, next month? How many sites do I have open? What amount of supplies do I need to get to these sites? Because then there's repercussions on that, right? I need to source that. There might be constraints there. We're now supply constrained for the most part, and that could tip in the next few months. We could become demand constrained, right? There's also all the work that authorities need to think about reaching all these population groups. There are some population groups in some regions that may not have access to technology, right? So they're not going to go to a website and sign up. They might have to call into a call center. So if you are an administrator, you need to think through how many call center employees do I need, right? How do I get ahead of some of these headlines? How do I look into the future, given all the uncertainty, right? A lot of today's planning and decision making is sort of a whiplash, right? You find out what allocation you're going to get, right, depending on where you sit, and then you quickly make plans to effectively distribute that allocation. But that's soon going to change, right? That uncertainty might go away. The uncertainty might be in terms of how quickly can I get the shots into arms, as Jan was saying. So modeling all of these and answering all these questions is what, from the conversations I'm having, people are having the most trouble with, right? At an operation level, these are the things that are keeping people up at night. They're just struggling to keep up and answer these questions effectively.
So now, the blind spots?
Yes, if you go into the next one, the blind spot really, if you think about, okay, how are people approaching this from a technology standpoint, right? What technology do people have that pre-existed, right? Getting vaccines out is not new, right? We've had the flu vaccine, again, much more of a stable thing. We knew the constraints, we knew the assumptions. So any entity, right, be it government, private enterprise, everybody has this basic set of systems, right? This is where you either get your registrations, you're doing your communication, you're doing your purchase orders, you're paying your invoices, you're cutting payroll, sort of the fundamental operational layer, right? That has always existed. And the other thing people have also always had is some way to look back at performance, right? Say what happened yesterday, last week, last month, and being able to do some analysis and learn some insights from your past performance, right? So those two layers have always existed. Now, what is missing, what has been missing, and that need is coming more to the forefront today with what we're dealing with, is this layer in the middle, if you click once more, Martijn, where if you think about the average decision maker, their job is to figure out the strategy and then put that strategy into practice. They need to execute against that strategy. Now, if you think about your own companies or your own organizations, think about how this happens, right? Think about the decision maker. They have those tools at the top, at the bottom, right? They can get the reports they need. They can analyze the data. They can visualize the data. But really think about, how do you make a decision and how do you operationalize that decision? And that decision could be, okay, I think I need to open 5 more sites, or I need to get, additional trucking capacity, or I need to staff 50 more nurses starting next week. Okay, you made that decision. Now, how do you make that happen? This is where, as a decision maker, you're having to pull together all of these different data pieces, analyze the data, but more importantly, make a decision with a full understanding of what the implications are. Right? It might seem like a great idea to open 5 more sites, but guess what? It might turn out you don't have the nursing capacity or the consumables. You cannot replenish fast enough. So and those data points.
The connection. So yes.
Yeah.
Okay.
I think I'm back now.
Yeah.
So those data points and insights that you need to really make an informed decision, that's where people are spending a lot of manual effort today, trying to put all of these pieces together.
So in the middle layer, you see a lot of Excels and maybe disk drives added to the current usual systems like ERP and supply chain systems.
Exactly. And this is the part of the problem, from an Anaplan standpoint. This is what we're focused on. And this is what we've done, right, as a company. But this is becoming more and more important. This is not the time to go and implement a large enterprise tool, right? That's going to take you months or years. What is really needed today is something that's super flexible, something that's really quick, something that can quickly knock out all these Excel files that are floating around, right? You really want to get rid of the manual effort, move all of your calories to actually making decisions and doing some intelligent forecasting, collaborating across this ecosystem, right? How do you collaborate if you're trying to distribute vaccines? How does let's take a central government body, right, like a CDC in the US or IBM, how do you then collaborate with all of your different partners, right, and have visibility to the same set of data? How do you make more intelligent forecasts given everything is changing so fast? How do you get real-time visibility? These are the things that we're finding are providing rapid value, right? This is where people find that moving off of this crazy Excel spreadsheet paradigm of just shuttling data back and forth and spending all my time just collecting and cleaning data, just moving off of that is giving people a lot of value in how fast they can respond to what's going on.
So a question from the audience. What do you mean with the agile collaboration in the IT sense here?
Yeah, it's really, if you look at collaboration in the context of how you make a decision, right? If you're collaborating, let's say the body or the department that is in charge of sourcing labor, right? Nurses and so on, technicians, and you're talking to somebody that's trying to figure out how to expand the number of sites. Both sides need to come together to figure out what are the implications, right? If for each new site, what do you need? How many shifts? How many people? What does the cost of procuring those people look like? What existing procurement arrangements do I have? So that's an example of both sides coming together, looking at a common data set, using common assumptions, and making a well-informed decision. And our platform allows that to happen in real time. It's an in-memory calculation engine with a collaboration layer on top. Right, so you're essentially asking and answering questions off of a unified data set. So that would be an example of how different decision stakeholders can collaborate.
So maybe you can explain the approach of Anaplan compared to others.
Yeah, it's really, one is a speed, right? As I was saying, the old approach, at least what we still see, and this is not unique to what's going on today, right? We have all of the large global enterprises we work with, we see this symptom, right? That messy middle where the decision making is manual and you need to connect all these different things, all these fragmented spreadsheets. So we quickly are able to get rid of that by bringing this unified dynamic modeling environment where it's really easy to model new rules and new assumptions, right? Let's say you've set up a bunch of drivers, right? When this all started, everybody set up a model to say, okay, I have Pfizer, I have Moderna, I need freezers everywhere, I need coolers everywhere. This is the time I can hold on to it. Great, we put in all those rules, right? And then we started planning against that. Oh, now we have J&J and AstraZeneca. It's a different set of rules, right? Different set of suppliers, different routes to market. How do you then easily model those additional set of rules without having to create more spreadsheets and more manual work? So that unified data modeling is really, I would describe our superpower, right? Being able to do that rapidly. And then once you have those drivers and rules and data models in place in a unified environment, you're then starting to get better at analysis, right? You get a single source of truth, and once you update something, because you've set up all of these in an interconnected fashion, once you add a site, and then you say, okay, this site is going to get this type of vaccine, you're able to automatically forecast what else do you need, right? How many consumables, how many people, right? How many vaccines can you deliver in a day? All of this is automatically calculated for you. And then what that lets you do is, from a decision-making standpoint, you're able to make decisions in a unified manner, not in isolation. Right? And we all see these headlines, right, where a particular site got a whole bunch of supply allocated to them, but they're finding out the vaccines are going bad. And we see this in the US a lot, right? People say, oh, just passersby were pulled in and they were given a shot because the shots were going bad and they had to get rid of them. So great that some people got vaccinated, but the scary part is it wasn't by design, right? It just happened. So you're starting to get better at linking all of these dependencies and making well-informed decisions. So that's sort of the way we've been doing it, all the way along. These aspects of the platform are becoming much more critical for this type of a problem.
Yeah. Maybe to add to this, I know the software of Anaplan for quite some years. So the starting point is that you can upload Excels and make it more robust and manageable. So if you go into Anaplan and you look on a cell in what we used to call a spreadsheet, but now within Anaplan there's a cartoon cloud with the text stating what this cell is doing. So everybody can understand what this spreadsheet-like environment will do. So you can upload existing Excels, isn't it, Ara?
That's totally right. I mean, that's the immediate way to reduce the pain in that decision making, right? Now, typically we start there, but as these things mature, what we see with our enterprise customers is we eventually replace a lot of the old ways of old siloed tools, right? Our customers might have multiple tools across multiple planning dimensions. We in that sense, we're a true enterprise platform. We replace a lot of these tools. But yeah, I mean, the rapid time to value comes from being able to get rid of that clutter, get much more higher fidelity decision making really quickly.
But in the end, a lot of companies still use Excels because that's it's custom made for their environment, particular environment. Maybe a specific planner has an Excel for his or her environment specifically, and you want to maintain this knowledge, this intellectual knowledge into your environment, and that you can include in your environment in Anaplan.
Absolutely. I mean, spreadsheets are a great personal productivity tool. They're not a good collaborative decision-making tool, right? And that's really the core of it. It's great for somebody to quickly model something out. So what we've set out to do is combine those aspects of spreadsheets and Excels, but also bring it into that realm of this needs to be collaborative and enterprise-wide and scalable.
Could you explain how connection planning looks like in action with a customer?
Yeah, happy to. Like I was saying, we've been working with a number of large companies. And as I was saying, most companies start off with, wherever there's very acute pain, right? Where the systems and the processes and data is so broken, they are paralyzed, right? In making decisions. So the platform really lets you start at a point where you want to quickly address a problem, deliver value, start making good decisions. If you click into the slide, Martijn, I just wanted to talk through this example of Tata Steel, obviously a large global company, as you can imagine, with this type of a company, very complex global supply chain, right? From raw material sourcing, all the intermediate processing, and then all the different routes to market, right? And different forms of products that they put out, between sheets to finished product and so on. In this example, they really started with that S&OP area because that's where the pain was. And for those supply chain practitioners on the call, you'll appreciate the hardest part in S&OP is the consensus process, right? How do you bring all of this together? And most S&OP teams spend an inordinate amount of time just putting together that one perfect PowerPoint that you're going to take to the consensus meeting. And then someone asks you a question that goes, oh, what if this changes? And then you have to go back, right? Rerun your spreadsheets, recreate your PowerPoint, and the consensus meeting is not productive. So that type of a thing is really where a lot of our customers begin, right? And then, as you can see in this case, they started with that core, connecting the demand and the supply, getting to that control tower concept, getting some forecasting in place, bringing it all together, being able to make good decisions from an S&OP standpoint. Now, once you do that, what is the next thing, right? If we think back to what I was talking earlier about, how do you take these decisions and execute against them? This is where they went next, right? Once we make some decisions based on the S&OP, how do we then push it down, or how do we connect other inputs into the S&OP process? That could be around financial aspects of it, right? How much CapEx do we need, or how much raw material do we procure, or operational things like maintenance. And if you hit the button one more time, or it could be around additional commercial things, right? So you're able to connect both the demand and the supply and the operation side of it, which, at the end of the day is what true S&OP is. But as you can see, it spans multiple paradigms, right? As we've thought about, when people think about planning and planning tools, they typically gravitate towards, oh, I need a supply chain planning tool, or I need to use a financial planning tool. This concept of connected planning really transcends those silos by design, right? Because we believe a lot of these decisions are interdependent. You cannot make a good supply chain decision without understanding the financial implications of that decision, right? At least you won't be making a profitable decision. So for us, it's really important that all of these pieces come together. And I thought this was a good illustration of how you kind of start with the most acute pain, deliver value, and then you're able to build on from there. And as you can see, in the case of this customer, they started with those dark green boxes, and they're deploying more to it. They're self-sufficient with it. This doesn't need any super specialized skills, right? As Martin, you pointed out, because a lot of this is done by your average supply chain analyst that has a good understanding of math and spreadsheets and formulas, right? There is no coding or programming. There is no specialized, screens or buttons that need to be explained. It's sort of consumer grade planning, if you will.
And what's interesting here, even within Tata, this dark green started somewhere, so they didn't implement the whole honeycomb, the dark green honeycomb at once. Also within the S&OP, they started somewhere, demand forecasting, for example, whatever.
Exactly.
Interesting, talking about the vaccine supply chain, it is also, and we see that later by TCS, it is an S&OP process, I would say, with product review, demand review, supply review, and a financial consolidation, I would say. But maybe you can explore a bit what Antoine has been doing in the vaccination planning in the US.
Yeah, absolutely. Like I said, we kind of started down this path when the testing efforts were ramping up last year, right? We had, at least in the US, we were trying to ramp up testing as quickly as we could. So we played a role there. But since then, we've been working with our partner ecosystem, and happy to have TCS today to share, the solution they've built on the platform. But we really looked at this problem, that going back to that messy middle I was describing. In this case, we're working with a large state in the US, really large in terms of population, right? And they have a number of vaccination sites, as you would imagine. And for them to collaborate with the command center, which is where the centralized allocation, the coordination with the federal government is happening, and these are all state-run vaccination sites, right? So they have to essentially set these up. The state is pretty much in the retail business now, right? It's a good way to think about it. The state just opened a network of stores. Now they need to stock the stores, they need to staff the stores, they need to understand performance at each store. So how do you do that if you're a state? You've never done this before. The way they started to do it was obviously throw people and spreadsheets at it, because that's the only way they could get going. But soon this became untenable, right? This is not sustainable. You can't add more sites. You're not making good decisions. So we were able to replace all of these spreadsheets and data sets going back and forth with that unified data model real-time platform that I was talking about earlier. And what that has meant now is, people at the sites, instead of spending time filling out spreadsheet templates and, sending emails back and forth, they're able to record everything, and we're able to pull a lot of the data from their existing systems. So what the state is now getting is real-time view into performance and depletion of inventory, how many vaccines were administered, are we running low on consumable supplies, and sort of make some forward-looking plans, right? That's the critical part about this, is to make decisions about the future. Now, with this, they're also not just manually making decisions. Now they have the ability to run some advanced forecasting models, right? Based on what we see at each site, in urban versus rural versus pop-up sites, mobile sites. How is inventory being depleted? When should we replenish? What is the most cost-effective way to do that? So just an example of how we were quickly able to, and this all happened in a matter of weeks, right, for the state, for them to install this capability and start rolling it out. So I thought that was a good example of how what we've always done for enterprises is really proving valuable in the public sector as well.
Okay, thanks, Ara. Now we go move over to Murali from Tata Consulting Services. They have built on Anaplan their own ecosystem solution for this purpose. So Murali, can you explain what you have developed?
Sure, Martin. So good morning, good evening, everyone, wherever you are. So my name is Murali. I'm responsible for leading strategic initiatives within Enterprise Applications Group in TCS. And today I'm going to throw some statistics to really look at the complexities associated with this mass vaccination initiative, so that we set the context for how a modern planning tool could really help address these challenges. So if you look at today's world population, which is 18 years of age and above, we have got about 5 billion people who needs to be vaccinated. Whereas where we stand today, in terms of covering the population, we have just covered 265 million people only, which is just about 5% of the target global population. Second important statistics, if you look at the countries to be covered, COVID has really devastated about 219 countries across the globe. And where we stand today, only 114 countries have really seen vaccines, and 8 others are yet to see the vaccines. In terms of the quantum of vaccines to be produced or manufactured, I think it's close to 12 billion vaccine and projected to be produced in the next 1 year, 2021 plus. And I mean, this is based on the assumption that hit 2 dosages per adult, and then considering some wastages as well. And these are just produced by 6 countries at the moment. So now you can imagine the cross-country supply chain volume and the movement of vaccines shipments from just 6 countries to 219 countries. That really shows the supply chain complexity that we are all talking about. The next important statistics that we need to really look at is the speed at which the vaccination drive has to be done. So assuming a target population of 1 million, a target population of 5 billion to be completed in the next 1 year, we need to really touch a run rate of 27 million dosages per day, which means we currently the average rate today is only just 5 to 6 million on average dosages per day globally, which means that is a lot more gap that needs to be addressed. And I think that was also resonating with the Dutch example that the professor was talking about. So now I'm going to touch upon some of the challenges that we see in the ecosystem. So while Ara Gopal established a vaccination ecosystem which is linked with multiple stakeholders, I would like to bring out some of the challenges which are basically associated with the ecosystem. The first and foremost one is, as we have seen, the pace what we are seeing today is nothing as compared to what we are expecting to go up. So the pace and scale is getting accelerated day by day, which is very much unprecedented. Second, the vaccination scenarios and the associated service delivery models are continuously evolving. Of course, they are improving, which is good, but they are very dynamic. The third important parameter, if you look at the need for handling multiple vaccines, which require different storage conditions, which is actually adding more and more complexity to the logistics and distribution aspects as well. The fourth important parameter or cause of concern is that the entire vaccination ecosystem is constantly being disturbed with new and new stakeholders coming in, like manufacturers, new service providers, and also the shift in the vaccination phases. So now that are also mentioned that more and more pharmacies, community pharmacies, and large pharmacy chains are getting in the US scenario. So that adds more complexity, but it is good to address to the scale needs. The last important challenge that most of the stakeholders in the vaccination ecosystem are facing. Actually, many of these activities, be it planning or execution, many of these activities are carried out in multiple different systems. And there is no one system that is actually built to address that. And most of the data part is being captured manually. And the planning and reporting happens in a much siloed way. And there has to be a lot of reconciliation that needs to be done between Excel sheets, which is adding much more complexity. And that is actually hindering any real-time visibility or smart decision making in the overall process. Having said that, I would like to now establish the need for a modern cloud-based connected planning tool. And I would like to give an enterprise view of how this should look like, basically looking at the three different layers. If you look at the bottommost layer, I would say it's the first and foremost layer is the platform by itself. So the platform should provide the necessary scale and agility to cope up with the pace at which the vaccination is set to go or set to grow. And also it should be having the ability to handle multiple dimensions around vaccination. It cannot be just one tool for supply planning, one tool for resource planning, or one tool for your financial planning. There has to be multiple dimensions within the same platform so that you can have a connected planning and things can be managed much easily. And above all, since we are handling huge volume of common public data and also having sensitive vaccine information, the data security and data privacy aspects are very important and have to be ensured. So the bottommost platform drives significant resilience for the entire vaccination, provide the necessary scale, agility, security, and everything on cloud, public cloud. Now let me come to the second and middle layer, which is all about driving robust planning capabilities and functions that are required to address the complexity around the vaccination rollouts. The very important functionality or feature is to perform connected planning in a much orchestrated way. Where I do change in one particular dimension, it should be reflected automatically in the other dimension. That's what we mean by orchestrated way, so that we don't need to worry about multiple dimensions. All of them are taken care of in touch one. Second, very important that we need to have robust what-if scenario management to plan for the unexpected. Because you might end up in different scenarios where you are short of supply and the huge demand coming in and the demographics changing, etc. So you need to have a very strong what-if scenario management. Then modeling and demand forecasting for end-to-end vaccination resources and inventory needs are absolutely important. Now you look at the top layer, which is basically about driving advanced analytics, is set to drive intelligence across the entire vaccination ecosystem. Okay, if you see the value delivery on the right-hand side, each layer has a very clearly set value delivery. The top layer driving real-time predictive insights to take faster and smarter decisions, whereas the application layer at the middle drives effective vaccination efforts with optimum efficiency and without wastages of any resources or cost. The platform layers provides the much required resilience through agility. And again, it's a highly configurable, should be a highly configurable platform with much ease of deployment. And it should not take multiple months to deploy. Rather, it should be deployed in a few weeks of time, unlike in some of the large monolithic ERPs, which may take months and years to deploy. So these are some of the salient features that a connected planning tool is of great use in this scenario. Now let me come to the TCS Connected Planning solution, which is a completely holistic planning solution built on top of Anaplan. And it addresses multiple vaccination planning scenarios, right from a macro level to a micro level. When I mean macro level, you can do strategic planning, typically done by a federal government or a state government to get the big picture for vaccination, like number of vaccination sites required, the manpower required, the consumables, the cost, vaccines, etc. So you can definitely do a strategic planning at that level to really drive a big picture and dashboards to the respective countries and the vaccination sites. And also the solution addresses multiple horizons of planning across different functions. So allocation and distribution planning, demand planning, inventory and vaccine storage planning across the supply chain. And if you look at the financial area, you have a very robust expense and budget planning, which can cater to your various expense planning and also analysis for cost variance. Then you can we have a very robust planning tool for estimating the manpower resources need for entire gamut of resources, including this staff rostering for some of the jobs. Okay, having said that, I would like to pick up a couple of scenarios, planning scenarios, and highlight how the connected planning tool is really helping some of the stakeholders in the vaccination ecosystem.
Okay, Murali, we have some a few slides about actually the SNLP stages. Could you mention them briefly, because we have only 4 minutes actually, but I will give you some time. But you can go to the scenarios and highlight them briefly if you like.
Oh yeah, absolutely, sure, Martin. So the first and very important planning capabilities is the allocation capabilities, where this is primarily in a situation where the demand exceeds the supply and actually requires a rule-based allocation. So here it considers multiple variables of planning, including the demand side, like overall demographics with prioritized population, and the supply side covering the vaccine and its ancillary availabilities, etc., which keep changing over the various phases. So you can here define the rule sets for allocation across states, countries, and even vaccination sites. And you can simulate multiple what-if scenarios as well. So now I'm going to look at another scenario which talks about demand planning capabilities. This is one of the important capabilities in the vaccination drive, and this will be done iteratively. It covers multiple demand elements like material, which includes vaccine ancillaries, consumables, and manpower. And it's a robust bottom-up approach to arrive at the demand forecast, where we can set the hierarchy for roll-up demand. Starting from vaccination sites, you roll up to zip code level and then to country level and then to a state level. So you have a robust bottom-up roll-up of the demand. And the source for demand could come from different sources in terms of real-time from the vaccination appointments for short-term planning. And for the long-term planning, you can actually derive from the target population for the vaccination. I want to touch upon another important one, which is resource planning capabilities, which covers the complete gamut of resource planning, be it manpower, infrastructure, or technology needs. And we can accurately estimate how much resources are required for a particular vaccination site, and look at a situation where one can also borrow certain resources from nearby vaccination sites. So you can manage the capacity better and you can effectively utilize the resources. The last planning that I would like to highlight in the interest of time is the expense planning. Managing vaccination efficiently is a very important aspect because there are limited budgets that each government has. So keeping the cost of vaccination drive within the plan and budget is very important. So the expense planning solution that we have built has a complete coverage of entire overheads, and you can use driver-based cost modeling and also perform cost variance analysis. We're actually looking at the plan versus actual analysis, which will give you much more details about the areas to focus and control the cost. So overall, I would like to summarize the need for having a robust, multidimensional, and connected planning with real-time insights to take faster and smarter decisions in order to accelerate the vaccination going forward. So with that, over to you, Martin.
Thank you, Marley. Jan, to wrap it up, I would like to say to ask you, what are the critical success factors for the Netherlands and the EU for this whole vaccination program?
Yeah, so I think if you look at the European programs in the next couple of months, I think the focus is on getting more reliable supplies. And as I would say, ideally they should be predictable, stable, and ample. And there are some indications that this is improving. If it's not ample or stable, at least it needs to be more predictable. I think the supplies is still the main issue. The question is when the turning point of that will come, right? So for sure, at some point, the supplies will become more ample, stable, and predictable. I'm hopeful that this will happen in the April-May range. To what extent there is actually planning ahead to increase vaccinator capacity. I think the last one is that we need more flexibility in the upper arms. I think that in the end will help us to actually be ready maybe 2-3 weeks earlier if we're really able to manage that flexibility well. In the longer run, and this willingness to vaccinate is quite high here in the Netherlands, but very low in a number of other countries like France or Germany. And if we really want to get out of this mess, if you like, then we need to ensure that also towards the end of the campaign, we vaccinate as many people as possible. And that may imply to bring also capacity close to the upper arms. And also use the analytics. I think there's ample opportunity to use data analytics, maybe to set up micro vaccination locations. Why not vaccinate at large concerts or festivals or other types of places where certain people may come that have less of a willingness to vaccinate, like some young people in some countries. So that's it. I think there's probably many more, but I would say the critical thing, these are these elements right now.
Yeah. On one side, my side, you are, asking the suppliers to make sure that they come up with the 3 months manufacturing plan, so you know what kind of number of vaccines will be coming in the next month.
Yes, I would say it would be nice to know this at least a couple of months ahead, because it allows you to build the vaccinator capacity in response, right? Martijn, you were talking about S&OP. Now, normally in a company in S&OP, you would have a forecast, and based on the forecast, you would then build your capacity. Mm-hmm. Given the extreme lack of reliability and even lack of a window, it implies that here in the Netherlands, for instance, we are now building vaccinator capacity just dramatically in excess of what could happen, just to be sure and to be ready.
Yeah.
So it's a reverse S&OP in a sense, right?
Yeah. And in a sense, the IT tooling is there. You can have on a higher level, you can share what Anaplan has showed on a secured basis. You can share your capacity planning as a pharmaceutical company on a higher level in an environment, only share what you want to share, like the Excels you want to share. So basically, it is possible.
And actually, we don't need that complicated information. I would say just give us 4 numbers of the 4 weeks in a month, and then 2 months ahead. This would really help.
All right. Thank you for you all. So we are on the hour, so we have a lot of questions popping in, but I would suggest that the people who still have questions, we have the 30 minutes left. After this, we go into the lounge and you can speak to the experts. They will be sitting at a digital table in the lounge, so you can ask this question directly to them, and you will be seated in a kind of a Zoom meeting with them. So I want to thank you for listening. I would thank Jan Francois for his contribution. So he has written a lot of books. And you see some contact details from Jan. So thank you for joining, and see you later in the lounge, Jan.
Yes. Thanks for the invitation, Martijn.
No problem. No, thank you. To the left, we have developed an end-to-end supply chain visibility assessment, a simple Excel to fill out, and you will get your white spots. You'll see where you have your white spot to assess the first. And on the right-hand side, you see all kind of information by Anaplan and TCS, what they have developed specifically for this vaccine management and distribution planning in a planned environment. So here are the links here, and you will get these links in your PDF if you want it. Next, I want to announce the next webinar Wednesday will be about gender diversity in the supply chain. We have a great speaker from Boom. She has done a lot of research about this topic. Very important, different kind of topic, but still very relevant. And with this, I would like to wrap up and thank you for joining as an audience. I would like to thanks again Jan, Ara, and Murli for this session. And we will go into the lounge right after this. So I will see you either in the lounge, or hopefully I will see you next week, or maybe in the future in another webinar. Thanks again, and let's go into the lounge, or I'll see you later next Wednesday. Thank you. Bye-bye.
Okay.